Okay, I'm starting the stream right now, okay?
Okay. It's not, they're not, there's a trending piece there. They closed down 2 buildings. So now, that's all continuing service in 18 and up there. So there's nothing for adolescents under the age of 18 or 21 in terms of inpatient stay. It's terrible. Terrible. They want to move, the Lighthouse program to the campus. So we, when I say we, I mean AD doesn't know if like
okay? You should tune in online because it's gonna be good information. Okay, okay. Come down and see me soon in my office. Okay, promise? Okay. Bye.
Can you open it?
Intro? Yeah. Oh. She did.
Can you move down a couple of chairs? Thank you. Sorry.
No, you're fine.
It's gonna take time.
That might have been you, but I wasn't sure, and then you went back. You guys are worse than students, everyone sits in the
Good evening to all of you. Thank you for being here. My name is Jessica Hutchings. For those of you that don't know me, I am the Family Support Services Coordinator for the school district. I'm a social worker. I'm the social worker who links all of our students with mental health counseling, who sets up presentations like the one we're going to have tonight. The Family Support Services program provides support during the holidays for families in need, school supplies. We do all of that kind of linkage from family to school in times of need for students. Our mental health counseling program is highly utilized by students in our district. Horizon is one of the agencies that we have a partnership with, so we have clinicians from various agencies coming into the school district during the day and providing mental health counseling for our students so that they can access that service more conveniently and very oftentimes more quickly than they may be able to access that if they were trying to do that out in the community. So we've had a great partnership with Horizon for over 6 years now here at Grand Island, and we're happy tonight to have Susan Zannoni here with us. She's going to do a presentation on ADHD in adolescents. For those of you who are with us in the audience tonight, if you have questions throughout the presentation, Susan, you're okay if they ask them, right? She would like this to be interactive, so if you have questions, please ask. For those of you who may be tuning in with us online tonight live, if you have questions that you'd like to ask, you can email them to me. I'll be monitoring my email throughout the presentation. My email address is my first name and my last name, so it's Jessica, and Hutchings is spelled HUTCHINGS @gicsd.org. So if you just send those questions via email, I can ask them of Susan, and we can make it as interactive as possible for those of you who are tuning in with us online tonight. So at this time, it's my pleasure to introduce you to Susan. I thank you for being here tonight, and we're very excited for your presentation.
Thank you.
Hello, everyone. I'm not used to the microphone thing, but we'll get used to it. So my presentation is about ADHD in adolescents. A little bit of my background is, so I've been working at Horizon Health Services in the Child and Adolescent Department. I'm the clinical director of the Child and Adolescents in psychiatry. So my background is, I have my Doctor of Nursing Practice and psychiatric mental health nurse practitioner. I also have my advanced degree in addiction medicine. We were just talking, Jessica and I, that I had worked at Renaissance House for 5 years, and so one of the big things that I had noticed, looking back, is that a lot of the kids that sometimes when their ADHD doesn't get treated, sometimes they will gravitate more towards substance use. So it's a really important topic and really important to discuss kind of some of the risk factors and kind of go through the whole kind of concept of ADHD, because we were talking about how today with social media, there's a lot of misconceptions. One of the misconceptions is that when we talk about ADHD, first of all, that's in the DSM 13, we talk about ADHD is now the term we use, and then we would say ADHD in my child has, a subtype of like inattentive, or a subtype of hyperactivity, or a combined type. So today ADHD is like the word for everything. So the hyper, the H part is still in there. It's not ADHD, which is, doesn't matter, but the lingo matters. So one of the big things is, why is ADHD a little bit more prevalent now than it was maybe even 5-10 years ago? And some of it is that we have better diagnostics in the sense of, with where I was talking about the social media, but it's also a good way of like, you know what, I have a lot of these symptoms, let me see if I need to get evaluated. So I think it's becoming more awareness, which is, I think, a very important part. I think that's with mental health in general. So it is getting diagnosed more often and getting treated more often. And we look at those risk factors again. If it gets treated early intervention, just like with any neurodivergent. So when I talk about neurodivergent, I'm talking about ADD, autism, any of your communication or processing disorders. Those are all in one cluster now. And so it's really important that with early intervention, you really can help that child. As we all know, especially when we talk about autism, early OT, PT, and any of those really help the long term. So it's the same with ADHD. So early intervention is very important. So and so overall, I'm happy that the social media has opened up that door, and it's important that our the youths do get first assessed and evaluated and possibly treated. So both girls and boys have ADHD. Boys present so different than girls that it was for a very long time, boys were getting diagnosed much more often versus girls. And so it's starting to level a little bit. It's still got some ways to go, because boys, you can see across the room when they have ADHD. So they have that hypertension. Did I say hypertensive? They're hyperactive, sorry. And so they're kind of, the classroom, the teachers know they are very difficult with some boundaries, so they're always kind of in other people's spaces. Hard time to time management with them, hard time to regulate. Where girls are so different. So young girls, when they present with ADHD, they are more internal. So their internal regulation is dysregulated, where when we talk about boys, their external is. So it looks different. So they're the girls that don't usually get in trouble. Those are the girls that are probably more, have more of that sensitivity. So they're more thinking internally more about, did I do this right? Did I do that right? So they're thinking a lot. So looks like they're daydreaming, in which they are. So there's a different types of presentation for boys and girls. So right now it's about every 3 boys for every 1 girl. So it's still more prevalent with boys. One of the other things that we have to look at is it's very, very genetically predisposed for ADHD. So that means that when a family member has ADHD, there's a pretty good chance that one of the other family members or a parent will have ADHD. We have to really be careful, like, with assessing that, because it's not because of the environment or because, dad had it or mom had it. It's really because there's a genetic predisposition to it. So when we see one with sibling with ADHD diagnosis, we really should be looking at the whole family system and who else is on it. So genetics, so when we talk about ADHD, it's the number one genetic predisposition for having it. So out of all the mental illnesses we talk about, anxiety, depression, schizophrenia, ADHD is the number one prevalence. So that says a lot. So people will say, is there a certain kind of brain chemistry? So we talk about the genetics. And what about environment? Does that play a role in it? Yes, obviously, yes, thank you. Genetics plays a role, environment, but environment doesn't, you don't get ADHD because of the environment, okay? It can, so there's not a causation with that. It can, the environment is very important how they manage their symptoms, but it's not a causation. So, people will say, well, I ate a lot of sugar, or if my child eats a lot of sugar, they're hyper, is that ADHD, or, if I had in utero, if I had, some complications, so that will affect. So you think that's why my child has ADHD. So any of those types of events, or any of that type of even parenting style, is not because that's why your child has ADHD. They had ADHD to begin with. It was just a matter of time when we look at that brain, especially that frontal part of the brain, that executive functioning, that part that has that working memory, has that kind of planning, time management, that's always there. It's just what you'll see is that it slowly starts to, is when the child gets a little bit older, and when they're, they have to manage a lot more, is when you're going to start seeing it more and more. So it's really important to realize that that has nothing to do with any of that environmental factor. It's really something that's there, and we know that. It's a genetic, and so with that said, how do we diagnose ADHD? And we can kind of look through the DSM-5 and kind of look at like all the different kind of criterias, but today I really want to look more closely of what does inattentive look like for a youth versus just saying, fails to close attention to details, makes careless mistakes, difficult maintaining attention in school and fun activities, does not seem to listen when spoken to directly. So even like if I take clusters of like some of those areas, one of the big kind of clusters is looking at that executive function that we're talking about. So for ADHD, it kind of comes in as that difficulty to regulate time, regulate planning, regulate something that does not give them that instant kind of reward in a sense. So when we talk about it in that way, if they have to finish their homework, and if they don't, say hypothetically, get a reward, it doesn't feel like it's enough to do it. So that's hence the problem with kids with ADHD is they usually have a really difficult time. They probably usually do really well on their exams, but they have a difficult time doing their homework, handing in it. That's too much kind of task-oriented to see the final outcome. So for them, there's no reward to it. So we have that difficulty. So when we say, following through on things, it's the same thing. Unless it's like, they're following through on watching a video game, they'll be there all night. But if they have to follow through on something that's boring or something that they really don't care about, it's going to be much, much more difficult. So we have to kind of think about an ADHD brain, a child's brain, versus looking at it from like a perspective of a parent or another child that maybe doesn't have ADHD, that their system, right, their reward system is completely different. And so we have to treat it differently. So the one thing is it either also says like avoids dislikes or reluctant to engage in tasks that require continual mental effort. So schoolwork, homework. Again, we're not getting that reward, right? It's, it's long, it's tedious, I'm not gonna get anything out of it at that time, but we're thinking about that time point, right? To them, it's like, I can't see tomorrow, I can't even see an hour from now. So, it's, that point where it doesn't make sense to them. They'll do great on the exams though, because, right, you're gonna get a reward of some sort right after. So again, it's different. They're easily distracted, or distractibility. Again, it's quite interesting, but kids with ADHD, they actually have their sensory system, their touch, smell, taste, is so different. So they are more sensitive to the environment than most people. So when they say they're easily distractible, it's really because they actually see a lot more. If you ever take a child out into the wilderness that has ADHD, they're phenomenal. They will see birds and things and leaves moving and everything. So it really makes it's quite interesting. But then you put them into a classroom that's very structured, and you've got a whole different child. So we have to understand that. So they need that kind of interaction. They need that something that stimulates them. For some kids, they do better if if they are in the back of the room looking at everything, because they are so multitask. They can see, they can listen to the teacher. They have to have things open. They have to have that kind of constant, because if they just have one thing, they will either start daydreaming or they will start just thinking about their own thing. So we have to really look at kind of that environment. And each child's different. For another child, it might be that to be in the front of the room. It really does depend on each child and how they kind of are processing information. Please stop me for anything. I really like interaction, so any questions, anything that, I don't know the population, if these are, families that have a child who's diagnosed with ADHD or thinking about it, or, so please, any questions, I'm really open to it.
What is the typical age to begin diagnosing ADHD?
So it really does depend on, if we talk about ADHD, you're going to start seeing it, you're going to probably even start seeing it when they're very young. It's going to be more of the reactivity of their environment. So when they're overstimulated, they're probably going to have a more difficult time regulating their emotions. So those are the kids that usually have a little bit of bigger temper tantrum when they're little ones, right? Doesn't mean you're going to have ADHD, but it means that they're already starting to kind of have some of those symptoms. And then it kind of falls into usually early elementary. So usually you start seeing a little bit more when they're about 7 years old, when they're starting to interact with other kids in the environment, and it's really difficult for them to kind of stay into maybe a certain format of the way the structure should be. So then you start seeing them in school where they will be having maybe some meltdowns with the teacher or the kids, or they will be taking other kids' things, so the boundary thing is a little bit, starts to show up a little bit. Again, it does depend on how that structure of that room is, right? If there's a lot of kids that are kind of in that same, then that kid's going to feed into that. Versus if there's a lot of more like well-behaved children, they sometimes can kind of start gravitating toward that. But eventually, it will show up. It just depends on each child. It depends on so many things. But one of the big things is that 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 distractibility. Again, kids, females present so different than males. So that's why girls usually do get diagnosed a little bit later than the boys, because the boys are disruptive. Yes.
I assumed you would get to this point, but I've never heard anything about treatment. What does a treatment look like for an ADHD kid?
Yes, yeah. I definitely will go through that for sure. I think getting a better understanding of diagnosing first, because a lot of times treatment it's a very multimodal, treatment's different for each person, for each child. It depends sometimes on the environment, it depends on the parent parenting styles. It depends on, the structure of things, So like we talked about, the subtypes of ADHD, there's the hyperactive, the impulsive, there's the hyperactive symptoms. It's pretty evident when we talk about hyperactive and what that looks like, right? Those are the kids that are swinging their chairs around, moving a lot, they have to touch, fidgety. They have to have a hard time just kind of staying still. They're kind of driven by a motor. The impulsive type are a little bit more difficult with kind of taking their turn. So they loud out answers. They will interfere with conversations. They have a difficulty with boundaries, even with space boundaries. They will become angry a little bit quicker than most kids. Again, we think about that impulse control. It's a poor impulse control, so their emotion goes from being happy to angry because they don't have that stop button to think about, oh, I should feel this first. They go from this to that. And so you have a little bit more of that emotional kind of dysregulation or anger. Or tearfulness for girls. Girls they're more sensitive, so they have more of the tearfulness. So we have to think about the, constantly of their rapid changing mood. It's because of the rapid changing environment, and they're very sensitive to that environment. So am I an ADHD teen? So ADHD teens, if we're looking more into the teens, so say that they didn't get diagnosed in early years. So now we're because I know we're kind of talking a little bit about the whole spectrum from early children to high school children. So they're more of the daydreamers, especially the females we talk about is the daydreamers. So they kind of shut things down and then kind of more look internally and start daydreaming. So they kind of present more with that inattention or the daydreaming. The disorganized is really different for each person. So some kids can be really hyper-focused and organized in one area and really disorganized in another. So it's kind of like, oh, they do so well and their sock drawer is completely lined up, but the rest of the room is like a mess. So there's a really kind of, I don't understand this. So you will get that. You'll either get the hyper-focus or the not focused at all. So it's really an extreme. And then as a hyperactive, as they call it, the whirlwind, very impulsive, very restless, and a lot of more emotional controlling problems, such as temper tantrums and stuff. And so in adolescence, temper tantrum might look different, right? It becomes more of defiance. So when we talk about ADHD in adolescence, and they say that they don't get treated, what happens is a very big percentage will end up with oppositional defiant disorder. Because if it's not treated, they're not able to regulate. So what happens is they get older, they didn't develop those skills, they didn't develop the things that they needed. So what happens is they become more oppositional. So it's really, and again, we talk about early intervention and treatment, and that's why we really do have to treat them early so they can develop those skills. Am I the caregiver of an ADHD teen? What do they need? So ADHD kids really need the extra support. We have to kind of look at it in the lens of how I treat them, not so much differently, because there's certain things, expectations for parents and stuff that, that things that have to be done. But what you have to look at is how you can treat them in a different kind of parenting style, depending on kind of their need base. So someone who has more inattentive type, that's kind of their things. They have a hard time with staying focused on one thing, or that they kind of veer off to many things. What happens then is that you have to can't overwhelm them. Say they have homework and they have science, English, and stuff. You would have to just do one subject, put it right there. So they're very visual people, the ADHD. So you only can't do one. If you have 6 of them there, it's way too much already. So they're going to shut down. They just want the English, and you're going to want just 2 pages, and you want them just to look at that. So once you overwhelm them, then that inattentive or that will go right up to I can't do it. So you have to start small. You have to kind of look at it from that lens where that looks look like too much for them, so then they shut down. I can't do it, it's too much, I'll never get it done. So everything that they're talking about is the outcome. So, right, it's really hard for kids with ADHD to look at the process. They just want to look at the outcome, right? The outcome is the dopamine. The outcome is like, that's the thing that's going to give me everything. So it's hard for them to look at that, the process of things. So we have to look at, to them, they have a lot of extra stress, right? Their brains are working completely different. And so we have to look at when a child who's struggling with ADHD, one of the big things we see is anger. I think that's kind of the thing that we see a lot of. And where does that anger come from? And I like to kind of bring this up is that, so kids with ADHD have a very low impulse control. And I'm not saying all, so please, some kids don't. It kind of depends. There's a spectrum here. It's not like all ADHD kids are built the same way, right? Some have more inattentive, some have more hyperactivity, so we have to kind of look at the whole spectrum. But kids with ADHD have a difficult time controlling their words, their body, and emotional in tough moments. So when they're feeling overwhelmed, everything goes out the window. It just kind of, they have a hard time regulating things once they start feeling overwhelmed. So the brain starts to struggle with controlling other impulses, especially when they are dysregulated. So that's why you see those temper tantrums at a kind of a bigger level than your, most temper tantrums, because everything kind of comes out at that point. They're deeply empathetic, meaning so ADHD kids are very sensitive to other people's emotions. So because of their surroundings and them being so sensitive, right? So they're seeing 101 things versus maybe you and I are seeing just a couple of things. They're scanning the whole entire. So they're very sensitive to their environment. So if someone around them is sad or angry, and that's what we're talking about the classroom. It's really important other kids that you put into that classroom because they're very sensitive to other people's emotions. They're very sensitive to rejection. So you'll find a lot of kids with intense emotional pain and sensitive to rejection, criticism, or failure. And one of the reasons is, right, when they're a child and they're supposed to be sitting there straight and they're twirling their thing and they're getting yelled at every minute because they're always disruptive, they're already feeling bad about who they are. They're already feeling like, that's how I get to talk to me is when they're yelling at me because I'm doing something. So they're already kind of have that sensitivity. So then when they get a little bit older, they actually become, more sensitive, but they show it in a different way because nobody likes to be put down. So we have to kind of understand that. A lot of kids, when we talk about defiance, is more of that sense of injustice. A lot of kids with ADHD, they always feel like, sometimes they feel like there's a sense of injustice. So they deeply care about things at a whole different, and they want to discuss it. So those are your lawyers, your doctors, the people that really make a loud voice and really want to change things. Those are those, people that are usually baseline. They have a lot of passion, and they also sometimes have ADHD. So a lot of your entrepreneurs and stuff like that, those are the people that had ADHD when they were a child. Sometimes there's a lot of social challenges, right? Because these kids really, one of the big things is they like to be liked. And so, but they don't have the right, I don't know how you want to say it, but they don't have the right kind of way of, like I was talking about, their space, or they'll take something, or kids really don't know how to relate to them because they are maybe, talk faster or do things differently. So kids sometimes will have difficulties having the social part. So we have to kind of keep that in mind. I talked already about hyperfocus, and then we talked about overstimulation. So kids that get overstimulated, and that doesn't mean anywhere. You'll just see after they get overstimulated, they're going to have a meltdown or get anger. So those are the reason why. It's because it was just too much stimuli, and they don't know how to process it. Because you got to think about an ADHD brain, it's looking at everything, and so then when they're overstimulated, they can't regulate it. Does that all make sense? Any questions? How long do I have?
We need to be done right around 7:30.
Okay.
I do have a question.
You
Yeah.
mentioned that the genetic component is strong in ADHD. Is that for the subtypes as well? So like if the parent is hyperactive, is it typical that the children are going to be hyperactive too, or may they be inattentive, or?
It's a good question. I really don't know the subtypes. I know that there's factors, that's where the environment part comes in a little bit, where if they're more predisposed to having more of the hyperactivity, and then they have a sibling that's also hyperactive, it's gonna be some learning processes to that. But I don't know genetically if the subtypes are, that's a good question though. I just know the ADHD component of it, where the brain part, where, you know, the frontal part of the brain, if you got a functional MRI, it would look different, completely different. It's quite amazing. I had a picture, but I don't think I learned this one, where it looks different. So we have to, you know, understand that. I need help as a parent, please. So what are some of the things, so we talked about, sometimes kids will grow out of ADHD. Well, true. Some kids do. The maturity does play a role. Some kids, it's not so much that they grew out of the ADHD, it's just that they have a little bit more skill set, they have a little bit more of their kind of, that brain saying, oh, that's not a good idea, maybe you should try that. Where when you're a child, you don't have that much regulation, and so then on top of you have the ADHD, it kind of goes from 0 to 100. So the maturity does play a role in some kids with ADHD, and I think it's also the spectrum again. So like if it's a very mild, like where their ADHD is more kind of pronounced in the inactivity or attention. So it depends what symptomology you're looking at too. So some of those you can learn new coping skills. Sometimes, like if it's time management, if you have a timer there, and so they kind of get their brains used to using a timer or something externally, because internally they don't have that regulation. So they have to use something externally. So you can help them with all those types of things. So it kind of depends what area you're noticing kind of that weakness. If it's more with time management, say they're not able to finish their homework, like we talked about, make it smaller for them, like just do one at a time. We have to talk about, you know, I'll talk about school and resources too, but like right now as a parent, you have to really look at where kind of some of their strengths are and some of their weaknesses are, and kind of go from that point. So I just did because I'm doing another presentation for Horizons, and they say because we now know that like adults have ADHD, and before it was like you can only be diagnosed, and it's still true in some ways that you really should be diagnosed before the age of 12 for ADHD. But because of the poor diagnostics in the past, what happens is a lot of the youths, because they're smart enough, they were able to kind of compensate, they don't get diagnosed until they are adults. So we have to really kind of look at, you know, adults, but most kids that have ADHD, about 70% end up being ADHD as adults. So it does transition over to adult. It just looks different. And one of the big differences, especially for males, is the hyperactivity part kind of goes away, but the other kind of components kind of stay. So we kind of have to look at that. We have to also look at that academic learning, right? So they learn different, they think different, they comprehend differently in the sense of too much information, and becomes overwhelming, then it becomes shut down. If it's not enough information, then they become bored and then they're thinking of something else. So it's a very kind of interesting kind of dynamic that kind of happens with kids with ADHD. So that's why you'll see some kids with some courses, they will do phenomenal. They'll be like a straight A in math, and there will be a D in science or D in ELA or something. So there's sometimes a really big extremes with that. So we have to say, okay, our weakness is ELA. What can we do differently in that class so that we can help them? Is it, you know, too much information? Do we need to take it in bits? Is it, you know, the test taking, that there's too many questions at one time for them and then they feel overwhelmed? So kind of have to figure things out. So I just said ADHD teens hit more bumps in the road. So we have to look at it differently. what ADHD teens need from caregivers. One of the big things is patience, because it gets quite frustrating sometimes when you're constantly telling your child to do something, repeat it over and over, and it just doesn't seem to get kind of processed for that child with ADHD. So I told them 10 times they have to get off of that computer in 10 minutes. You know, an hour later, all of a sudden we're having a temper tantrum or something. So we have to look at it differently, because if you just say you need to get off of that computer, 99.9% of the time, they probably are not able to, okay? You gotta think about that dopamine and that reward. It's like, say you have a big steak dinner and you're gonna say, yeah, take it, and you haven't eaten in a week. And I'm gonna take that away from you, right? That to you, that's like, wow, don't do that. It's the same thing with a kid with ADHD. They can't like have that kind of, okay, that's gonna go away, but I know I can come back to it. To them, it's like, you're taking that away and I don't ever know if I'm ever gonna get it back. So it's kind of that whole kind of way of looking at it differently. So we have to look at it in that way. So if you have, again, a certain like, you know, so kids with ADHD do very, very well with rewards versus with anything negative, then it just puts their low self-esteem. They feel like they're doing, you know, it's a kind of a constant, you know, low self-esteem will then get them to be less motivated, become more defiant, versus positive reinforcement, they do so much better. So when we talk about positive reinforcement, say that day you told them to get off the computer, and it might not be that 5 minutes, because sometimes when we kind of have too much structure, it becomes then the challenge of that time. But if they have a reward, say if that week, if they do it all week long, they get XYZ, that's what's gonna motivate them. So we have to really look at it differently, how to motivate them. And they're very visual people, so you wanna have those charts. You wanna have things so visually they can see it. You want them to do it. A lot of teens, like we talked a little bit about the belonging, right? All the other kids are sitting there, they could be able to read a book, they're able to do this, but in some kids, they're not, so they feel different. So one of the big things is really to kind of help them, show them their strengths. So kids with ADHD, they're really good usually with their hands. So they do really well, or they do really well in gym class. So we have to kind of look at their strengths too, and kind of make sure that we are reinforcing that. We just talked about, you know, the people with ADHD, they're, you know, they look at things, their environment different. They're they use, you know, they're right and the left side of their brain. So they're musicians, they're comedians, they're athletes, they're visionaries, they're leaders. So it's just kind of getting through those school years sometimes that become difficult. I talked already about, and I'm not going to go too much into this, but about those neurotransmitters. So dopamine, which is that reward part of your brain. So when you eat a great meal, that dopamine comes out, right? And so then your brain says, oh, I want to try that again. Norepinephrine is also another neurotransmitter that is affected with ADHD, and those are the two main neurotransmitters. Norepinephrine is that kind of that, and when we talk about epinephrine, right, that fight or flight. So when that's kind of hyperactive, that's kind of when that's kind of too much in that one kind of area. So the dopamine and norepinephrine, and so that's why we talk about, and I'm not going to talk about it today, but why medications work so nicely for kids with ADHD is because it's targeting the two neurotransmitters that are you know, dysregulated in the brain. So teens with ADHD lose attention unless something is constantly interesting. So a video game, they'll be there all night. They can be there 15 hours. Schoolwork, not so much. Again, hence is the challenge, right? ADHD is not a choice. ADHD caused or related, so we also know there's a lot of comorbidities. So kids with ADHD have a lot of more comorbidities, meaning they have generalized anxiety or disorder. They have depression, major depressive disorder. And sometimes kids with ADHD will also have autism because it's in that same spectrum. It's in that. So there's significant comorbidities with kids with ADHD.
Can you talk a little bit about the types of things that are done in talk therapy to assist kids with ADHD? Like, I know you mentioned about how a therapist might assist a child who is trying to learn some of those coping skills, or what some of those coping skills might be.
Okay. So a young, it kind of depends also on their developmental stage, but if we're talking about a young child, you kind of have to think about kind of their developmental stage and what's important, especially when we look at, like, you know, if they're building their self-esteem, so they're, you know, more of a elementary child. It's going to be really important that we maximize that area. So when we talk about any types of therapy, it really is more, first of all, a behavioral kind of push to it, because the behavior is the thing that really kind of is the most part that where they get into the most trouble. But the behavior doesn't come until you kind of look at the cognitive part of why they are doing it. And so building up on that is going to be really important. So it's not, kids with ADHD, once they get the concept, then they can kind of, they can get it and grasp it. But until they get that concept, it's really hard for them not to keep doing what their brain is telling them to do. So it's about reinforcement. There's a lot of reinforcement. And that's where we're talking about parents to be patient and have humor, because that's where kind of we run into, like, I told them 20,000 times not to do that, right? So it's like if you say the same thing, you're going to get the same reaction, versus we have to look at it, what's important to them, what will make a difference in their kind of behavior. And that's where we talk about the positive reinforcement. So having visual, having charts, having stickers, having them do it too, having them come up with what's important to them is really the key things there. So it's about them taking the kind of that, so they can feel good about what they're doing. So it really is based on because they are very strong-willed, right? We know that. So we want to use that versus kind of working against it. Does that help? So we talk about this, you know, executive skills are like film directors in the brain. Film directors control the actors, lighting, and music. Executive skills control how we think and work in specific ways. So that executive skill is the thing that we really want to look at, right? So if we're looking at it as an actor, the brain will tell you one way, but that director is going to look at all those other components, right? So a child who has too much stimuli, you will know by the end of the day that they had too much stimuli. So what we want to do is take some of those kind of the lighting and this and that, and we want to kind of direct it in a certain way, because those are going to make a huge difference with the outcome of how they're doing in school and stuff like that, even at home. You want to give them the timeouts, not the timeouts because they're bad, but timeouts because they were overstimulated and they don't know how to regulate that. So we talk about executive skills, we're talking about that working memory. And what's the big thing between working memory and memory? So when we have a memory, it's about something maybe in the, you know, in the past we're thinking about, but working memory is something that they're doing right then and there. So their working memory is the thing that's really the most difficult. So we really want to look at that working memory and how to help them develop working memory versus, you know, just memory. And that's, you know, reinforcement. We talked a little bit about there's a lot of comorbidities such as auditory processing, communication disorders. So if we feel like there's also things going on with that, we really should get a full neuropsychological evaluation, which, you know, it's a little bit difficult sometimes. There's not a lot of neuropsychologists around, but if we feel like it's showing up at school or like when information is being processed, it's becoming difficult, we really want to make sure that it gets evaluated. So again, executive skills are deficits that leads to learning challenges in school, significantly. So we want to, you know, give them the extra help in reading, comprehension, written expression, and you know, math, and all those types of things. And I said, like some kids do, ADHD kids will do really well in one subject and not. So we really want to see what's going on with that subject, because it'll show up throughout the years. 3 separate influences when we talk about kids with ADHD. I like to look at it more in kind of the potential of a child, and you will hear that a lot, especially with kids with ADHD, that they are full of potential, but they're not say they're not handing in their homework. So instead of them getting an A, and they'll get an A on the exam, but they won't hand their homework in, and then they will have a D in their class because of it, right? So they're full of potential because they do well on exams, but they're not doing anything else. So that's why we call lots of kids with ADHD, have a high potential, but they're not maximizing it. We want to look at the behavioral challenges and then the executive challenges. So I kind of just broke it down to the daily life versus academic versus social. So for daily life, we really want to push the independence because, again, we talk about kids with ADHD, and the more independence they have, the more they feel good about themselves, their self-esteem, that they can do stuff on their own, even if it might take them a little bit longer or a different way. Independence is huge. We know that kids with their daily life, they're a little bit of ADHD kids are more stubborn, more willful. We talk about defiance and how, helping them with defiance is just a level of them kind of taking control. So how can we make sure that they have that control so then they don't have to get defiant? So daily life, they're very energetic, they're daring seekers, right? The sensation seekers, these are the kids that are very creative, we talked about. Academic, a lot have a very difficult time planning ahead. So what does that mean for a parent, right? If you say you have an exam at the end of the week, you got to start studying. Oh, that's probably not going to happen. Their brain doesn't say it's important, it's emergent, it needs to be done right now, okay? So the motivation's not there to help them. So what happens is if you keep saying you have an exam by the end of the week, it's probably not going to be until Thursday night at 10 o'clock is when they're going to start thinking about it. So really, if you have to look at it differently by just taking maybe a section of that studying and just do that each day versus kind of throwing it all at them saying that they have an exam at the end of the week. So you have to do things in small pieces for them because their brain just doesn't work the same. And then social, we talked about all these things, right? They're good leaders. We want to kind of enhance that. They like the social part of it. They're charming. And at the same time, they have a short fuse, right? So we got to kind of look at some of the things that maybe we want to look at socially and what we want to work on. We talk about family. When there's disruption in the family activities, right? So kids with ADHD have a hard time with change. Again, they have certain expectations, the way that they think the environment should be. So sometimes changes can be really difficult. So we want to make sure that they are prepared for change. Making sure that you tell them, this is what we're doing, and you have to say it maybe a couple of times. You might have to have it on the visual again. You might have to have it on the chart. Today we're going to go to the doctor. So today we're doing that. Because they need to have that kind of reinforced multiple times. They're not going to remember the first time. Kids with ADHD are hard to discipline. So we have to look at how to discipline them in a different way. It might be different than a child who doesn't have ADHD. We talk about anger. We talk about kind of household chores and upkeep. Again, you can tell some children with ADHD that they have to clean their bedroom. To them, it's too much. So you have to kind of take it into pieces and parts. Today, this week you're going to have to make your bed, and at the end of the week, if you make it for that week, you get that reward. So it is a whole different way of kind of looking at things. So we have to talk about, again, that defiance and how parents, one of the big things with parenting and with children with ADHD that become older and say that they haven't been treated, is that defiance shows up, like we talked about. But when you have two different parenting styles, so if you have one parent that's very strict, right, and every time that child with ADHD, is right on line and does it, picks up right away, and then the other parent who's really soft and kind of wants to talk about it. And so this child has two different parenting styles. For a kid with ADHD, it's probably not the best, right? Because they're going to manipulate that environment, because that's what they do. Any child does, but a child with ADHD does it to a different level because they want to get their needs met, and their dopamine or their kind of area where they will go to no end, and so they're going to work with what their environment is versus You know, some people, they can be with a strict parent one way and then a soft parent with the other, and they do absolutely fine. But we're talking about changes here, right? So what happens is, that's where we're talking a little bit about certain types of parenting programs like the PCIT, which is to help parents be on the same page, because that's what you have to really be, is on the same page for a child with ADHD. You want to make sure that the communication is the same for the mom as for the dad, and dad for the mom. And you're going to get a lot, well, you didn't do that with my brother, you know, so there's a lot of tit for tat. You didn't do that with my brother, how come you let him do that, but you're not letting me do that, right? So there's a lot of that kind of like, why aren't I the same as everybody else? Again, the kids with ADHD are going to always kind of compare that, because they think that they can do certain things, but then when you kind of put them to the challenge, it's difficult. So being on the same page with parenting is really important, so that they have that consistency. So school problems, again, this is like a scorecard where, you know, they will, you know, want to do their test really quickly. Some kids won't even look at the back of the test because they feel like they got it all done. And then you have the others, and this is usually the females. They will hyper-focus, and they will look at the sheet, and they'll be the last one. So really, there's a big difference when we look at different ways of ADHD can appear. It's not always the same. They lose track of time, big time. So, you know, if they're in a video and that reward, and they're on something they really, really like, they can be on it for a very long time. But if it's something they don't like, the time is completely different. So that time really does change with them. Difficulty with inattention, they're always blurting out when they shouldn't, they're always interrupting conversations. A lot of times when they get older, you know, it becomes difficult where, you know, people are trying to talk and they're blurting out things. So again, that inattentive can come out in different ways. Disorganized can be not only that they can't get organized, but they can't even get started. So we have to think about, how do you get them started? How do you get that motivation, right? Their brain's already saying, I can't do this. So that disorganization in their brains already is there even before they even begin. Some kids with that are disorganized, they have a difficult, and that's where we talk a little bit more about the different types of maybe comorbidities, such as a processing or something. So sometimes they're slow readers. They're absorbing differently. They're thinking differently. Their brain absorbs differently. Impatient or never proofreads. Again, it's just, you know, I did it, it's there, it's done, I'm glad, I want to hand it in. Easily frustrated. And we talked a little bit about that frustration and how that affects them. So homework, you know, too much at one time, they don't have their downtime, and you're asking them to go from school to now doing homework, right? And most kids, some kids can do that, and other kids can't, especially kids with ADHD. They need to have their downtime, they need to reset. Cannot sit still or wait their turn. Cannot plan or finish complicated projects, and that's a big one. So big projects, complicated projects, too overwhelming, that can't see really, you know, it's just too much. Those are the kids that, you know, don't finish them. They really just don't finish them. It's too much. So we have to look at that differently. It's not that they can't finish them. It's to their brain, it's saying, I can't finish it. Their time management, the time of starting and finishing is not the same. So to them, it's like, I can never finish this. So we have to think about that time part. Again, peers, I just call this a peer problem scorecard again. They have that space thing that we talked about with the inattention. Difficulties sometimes thinking of other people's perspective. That's a big one so that relationships with kids. So they have sometimes difficulty making friends because of that. Interrupt or dominate conversations. The social skills, we have to talk about, they have to learn some of those social skills. It doesn't come naturally. And again, we talk a little about the sensitivity to their environment. They're, you know, where they're hypersensitive. They're noticing when someone says no, or they're noticing when a friend is talking to somebody else. They're more sensitive than the most people. Peer interactions, we talk about space, we talk about maintaining friends, and unpreparedness. So when I just look at this developmental impacts of untreated ADHD, in preschool, it's more behavioral disturbance. Then in school age, it's more, again, behavioral. Then it starts showing up as academic. Then it starts going with pure relationships, and then with the self-esteem starts. Then in your adolescence, again, the academic becomes more significant. The self-esteem becomes more significant. And sometimes that can lead to more than legal issues, and sometimes that can lead to more smoking and vaping. So smoking and vaping, it gives you the dopamine, again, to, if you're feeling bad about yourself, low self-esteem, and you like your dopamine, smoking and vaping will give you that. They're more prone to injury. So those are the kids that are breaking their legs or in football and they have, broken things, or they're more risky, so they have more injuries. In college, you'll see academic failure if they're not treated. Occupational difficulties, so they'll go from one job to another, or they're not sticking with any jobs. Again, that low self-esteem is going to be throughout. Because kids with ADHD, depending how they're treated, that'll be one of the core things is low self-esteem. And then in college age is when they experiment more, so substance use. And so there's a high comorbidity with substance use disorder and ADHD that's not treated. Then in adults, occupational failure, self-esteem, again, self-esteem, relationship problems, and injury and accidents, car accidents.
If a child is diagnosed with depression and anxiety and a couple years later it turns out to be ADHD, how much damage is done within those couple of years?
Well, I think they're so interrelated. So damage in the sense of you were treating anxiety and depression. So no matter what, if a child has anxiety and depression and ADHD, okay, there's a difference, what came first. But you always want to treat the anxiety and depression anyways before you treat ADHD. Because if you put them, until you regulate that self-esteem, that constant worry, right? If you put them on a stimulant, it will, first of all, make things worse. So you want to kind of more do CBT and help with the anxiety and the depression first, and then treat the ADHD. So it's kind of that path that you want to do. If you feel like they never had anxiety and depression, it was ADHD from the beginning, you're in the same course of treatment per se. So as long, it's being identified in some form, which is good. And like I said, there's a lot of comorbidities anyways with ADHD. So a regulated ADHD child versus a dysregulated, right? They're actively listening when they're regulated, they're curious, they're empathetic, they have humor. If they're unregulated, they don't share, they have anger, scattered inattention, irregular eating, so it does come with the eating too, emotional flooding, anxiety, numbing out. So we really see a big difference between a regulated child with ADHD or a youth and an unregulated, and it's a pretty significant. And then this last part was just talking about a little bit about screening. So right now, the one that usually I'll do is it's a very decent one. It's public domain, so you can just Google, just put Vanderbilt ADHD rating scale, and it'll pop up. This is the one that's given to, so when you have ADHD, you're going to have it in all areas. So you got to have ADHD when you're at school, when you're at home, when you're at grandma's. You can't just have it in one place, then it's not ADHD. So you want to do the Vanderbilt, that's what I usually do. And I want to give it to a couple teachers. I want it to a teacher that a child's doing really well in, a child that's not doing well, right? Because we talked about how they sometimes can do well in one class and not the other. And then you want to do it in a different environment, such as home. And sometimes there's a big discrepancy, like school, they're wonderful, home, they're not, or vice versa. So we really want to see different areas and kind of then do an assessment. So we want to talk about children ages 6 to 12 can use other types of screenings. And so there are other ones, but what I like about the Vanderbilt is it does have, and of course it's just a screening. It's not a diagnostic where you want a diagnosis because you have a positive screening, but it also has, if the child has more of a propensity, if they have anxiety, depression, oppositional defiant, and they even have it with conduct disorder on this scale. And then the two websites that I recommend for everybody is called chadd.org, chadd.org. It's probably one of my favorites. I do a lot of, there's a lot of parent, you can even download the charts there. It's a very, very, very good website. And then the other one is called attitude.com, attitude.org, which I have here, but I don't think I can right click or anything like that, and we're running out of time. But those two are my favorite. Highly, highly recommend. You can get a weekly, through Chad, you can get a weekly, thing that they can give you every week. I don't know what you call it, the magazine thing. You can even get a magazine. But there's a lot of webinars, just a wealth of information in Chad. You guys have any questions?
So what are some of the red flags you would tell a family or caregiver to show it's not typical childlike development or adolescent development and maybe something more?
I'm sorry, what was the first part?
So like what like red flags do you tell families to look out for, to
Oh.
look out for that show, hey, this is beyond the scope of typical
Yeah,
development?
right. One of the big red flags is, like we were talking about, like depending, like a young child, where, you know, if they're having their meltdowns, they're more extreme. If they're dysregulated, they're really dysregulated, where it's hard to get them back until you kind of take some of the sensory parts away. If they're, depending on how that child, right, like when we think about kind of ADHD in the brain, we're thinking about that emotional dysregulation can come in many different ways. It can come in sleep. So a child that has a really difficult time winding down, getting their brain to shut off, sometimes that's a red flag saying their sleep has been disrupted from day one and it's still staying disrupted. So again, they can't calm that part of the brain down at nighttime. So it kind of depends, and I mean, environment does play a role. Like if they're, you know, you see some kids with ADHD, sugar is just like a bad combination with them because their level of hyperactivity for some kids goes way up. Again, it's telling me that they have that sensitivity already, and the sugar is making it even worse. Where another kid can have some candy and they're fine. So it really kind of depends on each one. I would look at genetics. Is there a family member with ADHD? That's going to give me some really good information. But it does come, you know, those kids are more difficult to, with anything. So they're more difficult in that environment, like, you know, to do, you know, it's harder for them to listen, it's harder for them to follow through, it's harder for them to do most tasks. Anything else?
I have one that was just diagnosed with ADHD,
Okay.
and I have another one who exceeds in everything.
Mm-hmm.
How do I treat the ADHD the way you said,
Mm-hmm.
you know, without the other one think I'm counting?
I think psychoeducation is really important, right? Because we're treating, they have to understand it's something where we're going to treat them differently because in some ways they are different. It doesn't mean they're different and bad, good, or it's just that they're different. They learn differently, right? If we all learn the same way, that'd be kind of weird. So if you kind of do more psychoeducation, that I have to do this is the way that they process information, this is the way that they learn, you know, it's just the way that it is. It's not coddling per se, it's just parenting. Like I think all of us, if we have kids, I think we treat one child a little bit different than the other because you know what kind of they kind of respond to. So it's more about how you're helping them with their environment and helping them with, you know, regulating that. So, and some kids, like you said, right, you can have one child who's like, don't have that problem at all, right? And then you have another one that has significant problems with like the same environment. I don't know if you got any emails or anything.
Not
Okay.
no emails around it.
Okay. Yeah.
My daughter has ADHD, and we're at the point where we need to kind of renew her Section 504 plan. And I think I'm kind of struggling with like what sort of recommendations I need to make. I think teachers kind of don't know what she needs
Mm-hmm.
either.
Yeah. It's very individualized in many ways, right? So some kids, giving them extra time on a test is not, like, especially for females, it's not something they really need. They do fine, right? Or for other kids, it's not really important because they feel like they have to look at the whole thing right away. So I think you have to kind of look at, even at home, at some of the areas that you're seeing. Like maybe it's more of that overstimulation where they need a little bit more downtime or that little bit of reset button for some kids. Sometimes it's right after lunch when there's too much sensory for lunchtime and you see them kind of act out. So depending what's kind of going on now, is this a male or female too? That's a big important part because they look different. So, yeah, it is not as, uniform to say, yes, everyone who has ADHD should get extra time for their test taking. It really is individualized, I do have to say. And some of it will show up at home first too, right? Some of the things you'll notice because you're with that child like on weekends and you know some of the areas that will be triggering to them. And those are the areas that you want to kind of relay when you're tapping about the 504 plan.
What is the 504 plan?
Do you want to?
Sure, so a 504 plan is accommodations that can be made for students who have particular diagnoses, ADHD being one of them. It's different from an IEP. It's, I don't want to call it less structured because it's not that it's less structured, it's different. But they are accommodations and supports that you can put in place to assist the child to succeed given the struggles they have with the diagnosis. I guess is the simplest way I can explain it. So like Susan's talking about, one example might be extended time to take a test or sitting close to the teacher so that you're able to focus better and not be distracted by the other kids in the room. You might have something along the lines of less questions on homework. It can really vary quite a bit as to what the accommodations are.
Who do I talk to about that?
Your school psychologist.
It makes a big difference, right? We talk about that sensitivity to the environment, right? Those little small details of changing that a little bit makes a big difference with kids with ADHD.
She has a very hard time with homework. And actually turning it in.
Most kids with ADHD do, right? So, and that could be something too, we're talking about with the 504, that it might look different, right? So,
She just has no interest.
Yeah.
It's all,
I thought I was doing homework, but she was actually turning it.
right,
That's the problem.
classic, right? Classic.
she's done that too.
Yeah.
Yeah,
And sometimes, so I worked in the middle school before I was up at the district office, and sometimes that, I worked with students who did all their homework, right, and then they didn't turn it in because they were so fearful that it wasn't correct, right, so they would get paralyzed in this fear that the answers weren't correct, and so then they wouldn't turn the assignment in at all. Other times they completely forget to turn the assignment
She
in.
was just completely disorganized. She just said,
Yeah.
so you don't think there, it was everywhere. It's like, oh, I just didn't say it.
Yeah.
yeah.
I mean, it really does look so different in every child, and that seems so cliche is not the right word either. It seems so oh, well, yeah, of course it does, but it truly looks so different in everybody.
And when they don't do it and don't turn it in, she falls behind.
Mm-hmm.
And then when she goes, she feels overwhelmed
Mhm.
because she doesn't understand what they're working on now. And
Mhm.
because she is so confident.
Mm-hmm.
Yeah. So their sensitivity to being overwhelmed is big, right? Because to them it looks different. Their overwhelm looks a lot bigger in a sense because they're looking at 100 things where maybe someone else is only looking at so many. So yeah.
If you guys have other questions that you want to ask Susan, are you able to stick around for 5 minutes or so?
Yeah,
If you
sure,
want to come up
absolutely.
privately and ask some questions, you're more than welcome to do that. Mark, I know you got to get going over to your next commitment, so you can go ahead and wrap up with the video. But thank you all so much for being here tonight.
Thank you.
Take advantage of some minutes with Susan if that's helpful for you. And if you have ideas on other topics that you would like to see us do these types of presentations about, let me know because I schedule them multiple times a school year, and I would really love to schedule them based on what I'm hearing parents want instead of just trying to figure out what I think parents might want. So if you found this helpful and there's other topics you'd like to learn more about, we're happy to find some